I think it's important that maybe before they communicate, they listen, so that they can better tailor their programs, immunisation programs, to the needs of those individuals and the needs of those communities. What we see in immunisation programs in Europe, which is quite similar to other regions in the world in this respect, is that immunisation programs are quite traditional in the way in which they reach out, in the way in which they drive demand, if we could say, for vaccines. We've had a fairly, not straightforward, but a fairly one-directional and standard methodology for driving demand up to 85–90%. Now to reach that final 5–10% in our communities, we have to be a bit more intelligent. We have to get more intelligence from those communities. And that's one area of work the WHO works in, is in assisting countries in tailoring their programs to meet the needs of those communities.
Well, it's true, the majority of people are vaccinated, but even if people want to be vaccinated, it's not always that easy. I mean, people are busy, they have to balance life and work. How important is convenience in this respect?
Well, I mean, inconvenience is a growing factor. There's no doubt that we have EPI managers, our immunisation programme managers, in many countries who are increasingly reporting that the way in which they deliver the services and the way in which they deliver immunisation is not meeting the needs of the entire population. That they need to make immunisation more easy, more accessible and more convenient. And that means providing it at times when people want to be provided with immunisation, times outside of working hours, for example. We know that there are countries in our region, France would be a great example of this, regions of France, where if you have to make an appointment with your doctor to immunise your child, you make that appointment, you visit the doctor, you collect the vial from the doctor, you take it home, place it in your refrigerator, you then go to make a second appointment with your doctor, you take your child and the vial to the doctor for one vaccination with one child. So you can kind of see that that's a big job. And some people would say, you know, if you've got 2 or 3 children, that's a part-time job in itself. So that's a real challenge, because it needs not only the motivation of the parent and the healthcare worker or the healthcare community to deliver that, but it needs political buy-in, and it needs a real commitment at a political level to make that programmatic delivery change.